today I'll be speaking about our long COVID clinic, what we call our executive wellness clinic. I'll talk a little bit about what is long COVID and some of the signs and symptoms. Slide. Next. So, what is long COVID? So, on the slides you'll see the WHO definition of what is long COVID, but basically the diagnosis is held up by 3 pillars, and that would be history of having COVID, symptoms beginning 3 months after contracting COVID, and those symptoms lasting about 2 months and not being able to be explained by any other illness. Next. So what are the signs and symptoms of long COVID? And so for patients who have had a mild course of COVID, as you can see, there are many signs and symptoms, but basically the common ones would be shortness of breath, fatigue, post-exertional malaise, and difficulty concentrating, what they call brain fog. Next. For patients who have had severe disease, however, as you can see, the effects would be multi-organ effects, so heart, lung, kidney. And when we conceptualized our long COVID clinic, those were the patients that we went about trying to serve their needs. Next. So our long COVID clinic really was conceptualized as a one-stop solution shop where patients could come within 1 day, get a wide range of services, and leave as a complete care package with everything being done within a single day. And so we would have had physiotherapy. We have a physiatrist on staff. We had to deal with the patient's pulmonary needs, so we had a lung specialist. We know that COVID had many psychiatric complications as well as social issues, so we had those specialists on the team. There were kidney complications, so we had a renal specialist and cardiac specialist, as well as having a dietitian and a pharmacist to round out the team. Next. So the process to coming into our long COVID clinic. First, you would have a specialized referral, and at the end of the presentation, I'll be putting up on screen the email address so people could refer to our clinic. And after the admission is screened, we would have a pre-visit screening. Now this is really important for how our clinic works. We'd make a phone call, and in that phone call we'd be looking to see if the patient has any special needs that we have to consider, as well as any special concerns that we need to focus on. In that phone call, we also decide of where we are going to place of our patient, because how the clinic functions is in cycles. There's a morning cycle and an evening cycle for our clinic, and it's because in order to make some of the assessments, you need a lot of information. You might need echoes, CT scans, x-rays, etc., and a lot of blood tests. And so we needed to have all of those things done before people saw the specialist, so that the specialist could make the best decision possible. So in that pre-screening call, patients get placed into a specific pathway in the cycle, and their pathway is actually charted out throughout the day. And so then we have the day of the clinic, people coming and they have their morning circuit that starts at 7 a.m. and patients get moved through the circuits where we gather the information for the evening circuit. And in the evening circuit, patients would get seen by our multidisciplinary team composed of the specialists that I spoke about before. And at the end of being seen by all the specialists, all of the prescriptions are collected by our pharmacists, our clinical pharmacists, who then goes through every single one for every patient to look for drug interactions. Should we have anything, because different specialists prescribe different drugs, we reconcile those problems in a team huddle for every single patient. So at the end of the day, the patient leaves after having spent between 6 to 7 hours, having seen multiple specialists, getting multiple investigations, and packaged completely. Next. So far, the clinic has seen over 500 visits since its inception, 183 new patients with 343 revisits, And for more information, people can email us at execwellness.agh@ncrha.co.tt. Thank you.